I see these pictures you do in CrossFit, and I actually refers to you a lot to my patients. And a few weeks ago, I was like, yes, you can. Because Juanita was lifting, I don't know how many pounds last week, but you can. And he's like, and my patient is like, Dr. Duma, who's this Juanita? I was like, go to Facebook and find Juanita. And then, so I want to know how, like, despite this horrible diagnosis and all of that, how you found the energy to do all that. And as a doctor, how can I, motivate my patients to stay active? Because we know they do better. It's very difficult to
Yes.
ask somebody to be active right after diagnosis, but I keep advocating that lung cancer survivorship is a reality, and as we study exercise and other cancers, we have to do it in our patients with lung cancer.
Yes.
So, as a doctor that will be looking at this video, how can we help and motivate our patients to be more active, after things kind of settle down?
I I tell people, like, newly diagnosed lung cancer, they ask, go, how did you do it? I'm so depressed, I'm so sad. I tell them, I was there, but you cannot stay there. I was there. I was even worse when my mom died, but you cannot stay there. Your family needs you. You're still living among the living. You're still alive. You're not dead yet, so don't act like you're dead. Okay, you're sad. Okay, cry, let it out, scream, yell, do whatever you have to do. But pick yourself up and say, you know what? I'm still living. If you stay negative, if you stay sad, you're not. Do it for a minute. Don't stay there, but pick yourself up. Walk, do yoga, do whatever it is that you feel that you could do. I tell people, anyone and anybody could do CrossFit. You start off small and you work your way up. I have 70-year-olds in my gym.
No, that's
Yes,
fantastic.
yes. They're not the best, but guess what? They're there. They don't use barbells, but they're using dumbbells. They use kettlebells. They're doing what they have to do. And so, I share people my story because they're like, well, if Coach Juanita is going through all this and she's doing this and I'm not sick, I could do it. So I'm telling my lung cancer community, my newly diagnosed doctors, if you have to share my story and tell them how I think, how I see things, outcome of life, then do it to give that person hope, to give that person inspiration. You want to see milestones? You're not going to see milestones at home crying, oh my goodness, I'm going to die. No, don't speak. And I tell them, don't speak death, speak life. Speak life speak what you want into existence. Set a goal, vision yourself. What do you vision yourself doing next year? What do you vision yourself doing in 5 years? What do you vision yourself, and set that goal and do it? No matter what. I don't care if you go in and they say, oh no, Juanita, um, we went from giving you 18 months to only 5 months. No. You say, nope. I always say the devil's a liar. Envision yourself. Okay, they gave me 5 months. I see 5 years. They gave me, they gave me this. I see this. So envision, um, set a goal, speak life, speak what you want to come into existence, and I promise you it will. It did for me. Okay, so I made it to 5 years. So, okay, so I have two spots in my brain. Is that going to stop me? No, that's going to make me fight more. That's going to make me push more. That's going to make me advocate more. And now it hit me. It hit my brothers and sisters, but now it hit me. So now I have to advocate more. Now I have to make some more noise. I got to get louder. I got to be that voice. I got to roar because I am not going to stop here. So, yeah, I'm going to be in my pity party for a minute, and then I'm going to pick myself up. I'm going to brush it off and say, okay, now I'm going to go full force and do what I have to do. So, my newly diagnosed people, don't stay there. Do everything I told you and find something to advocate. Start advocating with you. Start sharing your story in your community, in your local places. It could be a church, it could be a local hospital. Start being that voice, and you're gonna see that it gets better and better, and then you're gonna become that person that you're gonna be like, okay, no, there is hope, and and I'm going to help others like I've been doing, and that's just me, and I know everyone is not like me, and but I know that everyone has something in there. Everyone has a purpose. Find that purpose and do it, no matter what news you get. Don't ever, ever, ever give up.
Thank you, Juanita, for that message. And one last question before I let you go is, um, we also trying to get, doctors to also learn their perspective, because sometimes in 30 minutes when you have to go over scan side effects, appointments, what is something that you wish that many oncologists, not only lung cancer doctors, oncologists, we do in regards to patient education? So we can learn from you, because you have been in the saddle for 5 years and you
Mhm.
interact with many patients through your Facebook, now Instagram live.
I've been blessed to have oncologists that were very compassionate. Um, they understand to an aspect, but they don't understand because they don't walk in our shoes. Uh, I just, oncologists, medical professions out there, they really need to get more educated, um, especially in lung cancer, because yeah, all cancers matter. Don't get me wrong, but lung cancer, my goodness, how many are diagnosed? How many die? It's like an epidemic. So you know, I've heard stories where, oh, my doctor has a bedside manner, or my doctor this, or my oncologist. Yes, that is true. Educate yourself in lung cancer. You know, have some compassionate. Uh, I think if they educate themselves about lung cancer and what lung cancer really is and how it affects, and then, even new treatments, you could even give that person the hope. Because if that person is there and sad and crying, but if this oncologist comes and says, you know what, there is hope, sweetheart. There's a lot of treatments. There's a lot of clinical trials. There's a lot of these lung cancer organizations that are advocating, that are fighting for you, that are doing, they're being that voice. There's groups now. So if you're ALK positive, there's a group. If you're EGFR, there's a group. If you're ROS1, there's a group. And there's that support system that could help you. If they just tell a newly diagnosed person that, then that person will go from, not having hope to like, oh, there's a group for my type of mutation. Oh, there's groups out there that are doing this, that are being that voice. You got longevity, you have LCFA, you have Go To Foundation, you have, oh my goodness, you have the International Association for Study of Lung Cancer. They're even starting like a patient advocacy group. You have all these huge organizations that are doing everything for us and fighting for us and with us. So if just by telling them that, I think it'll, a lot of these patients would have that hope and won't really have that fear, and they have something to look forward to. But to me, is that compassion. I know a lot of doctors, a lot of them don't have that bedside manners, but just that the education and hearing, maybe if they go to some of these conferences and hear like our stories, and then that compassion would start to like, oh, I didn't know that. Oh, wow, and then that would help them to do what they have to do, if that makes sense.